you all for being here, and a huge thank you to Mayor Turner, Director Williams. They came out to support me as I get the COVID vaccine. I'm 8 months pregnant, and I know a lot of pregnant women are out there right now that are nervous about getting this. And we always encourage you to talk to your provider. But because the risk is so high for pregnant women with COVID, you're more likely to end up in ICU and on life support. There's studies coming out that may indicate preterm labor. This vaccine is safe, and we encourage you to get it with the guidance and instruction of your medical provider. There's a lot that goes into the safety protocol of this, which is why I felt so safe coming out here to get the vaccine through our city's health department. For example, there's one thing, and you go through a lot of different procedures and protocols when you're pregnant. You get a lot of different vaccines, and one of the requirements with this is that you cannot have had any other vaccination, including the Tdap vaccine, when in between 2 weeks from when you get that vaccine to the COVID vaccine. And unfortunately, I was not aware of that, so I'm actually not going to be getting the vaccine today. I'll get it 1 week from today. But it's the diligence of our health staff and our community that are taking so many precautions right now to make sure that this vaccine is safe for me, safe for my family, and safe for our community. So while it's there's a bump in the road with the vaccine, for me getting it today, I cannot tell you how excited I am to get this, and I'm going to hand it off to Mayor Turner because I know he has a lot of other information regarding the vaccine and the great work that our health department, under the guidance of Director Williams, is doing, including you, our chief medical officer at this community facility, and all of our healthcare workers that are heroes right now.
And before I speak, I want to bring up one of our healthcare people to explain how the process works and the checklist and how it works. And it is working. It worked in this case.
It did.
So, because you have to fill out the paperwork, and then they walk you through various things. So if you'll explain how it works.
So when you come in, we'll give you a packet which is like this, and it will go over your demographic information, your rights and responsibilities. It's about a 16-page packet. On the second form, it is considered a pre-checklist. On that pre-checklist, it will go over if you've had the vaccine before, if you've had any vaccine before. And just like she said, if you've had any vaccine within the past 14 days, you have to wait until that time period to get your second vaccine. Also, we have to make sure if any limitations, any allergies. So before you get your vaccine, we check this twice before you come in. So she is more than welcome to come back next week, and we will gladly give her vaccine because we have them to give. And she's a community that we really want to serve, but we just had to make sure that she was safe. And her baby was safe.
Well, first, I want to thank the council member for her willingness to share her personal experience. But also, thank you to my staff, because it's the diligence of the staff that actually followed the protocol to ensure that when we were in the guidelines as laid out by CDC. We're in La Nueva Casa de Amigos. This is one of our 4 health centers that are actually providing a COVID vaccine to our community. One of the things that we want to really emphasize is that the qualifying population is those individuals that are 65 and older, those individuals that are 16 and older that have chronic conditions. And in some instances, it's very difficult for folks to make it to some of what we call our mega sites. And so, therefore, we want to make sure that this vaccine is accessible to everybody. We're here in the near north side, which is one of the first communities I actually was on the ground and interacted with almost 16 and a half years ago. And so I'm really grateful that we're able to do this. As vaccine becomes more available, we will make sure that we have more community locations like this to ensure accessibility for people that have transportation and other issues that might preclude them from going to one of our centralized sites.
Thank you. And let me just say, I want to thank Councilmember Abby Kamen for allowing us to walk with her through this journey. And as she indicated, 8 months pregnant. We know that there's a lot of apprehension, reservations by people, and especially pregnant women. And so I appreciate the fact that she's allowing us to walk with her publicly every step of the way. And this is one of those, this is an important step here. Making herself available, coming, going through the checklist, and in this case, discovering had a vaccine within the last 2 weeks, and now having to wait another week to come back. And I'm glad that we're sharing that, because we want people to know we're taking every precaution to make sure that you are kept safe. We're not taking any shortcuts with anyone. Okay, with anyone. You have to fill out those forms for a reason. And then as they walk you through those forms, and they are going through those forms with you, we're making sure that we're following all the medical protocols. So, Councilmember Kamen, thank you so very much. We'll be back again. And look, and good or bad, I was going to be giving her shot today. So, but I'll be back to be with her on this journey. I will say that the mega site at Minute Maid will be open. Let me confirm that. We'll still go through the pre-registration. We'll go through the pre-registration, but that site will be open. We've also provided doses of vaccines to some other sites as well. And so the goal is to ramp up. But we were able to do a little under 4,000 on Saturday. Our goal is to do just as many, if not more. And then the way we'll work, we'll advance the list of people who have already enrolled, and then we'll back in bring other people forward on the registration. So make sure that you're following up on the HoustonEmergency.org/COVID-19 or make the online calls. But the goal is to get these vaccines out as soon as we get them, because we don't want them on the shelf. So let me stop. You may have questions to any of these health professionals or to Councilmember Andrew Kamen.
Mayor Turner, I'm the one. I've got a laundry list of questions for you today. All right?
All right.
So you had mentioned that a lot of people can go online to book their appointments, but a number of people who don't have access to the internet are struggling to make that appointment over the phone. The lines are congested. How do you plan to alleviate that problem?
It's going to be a while, because you got a huge demand out there. So you can either go online, you can make the call, recognize that the line may be tied up, or for example, like the registration for right now through the month of January is full. But as more vaccines come online, the spaces will free up, and then over the next few weeks or so, things will get a lot easier. But right now, there's a huge demand for a limited supply. So I just want to encourage people to be patient. I know it's frustrating. But just like, I think it was yesterday, when the hospital that's doing the drive-by on NRG, when they open it up, Methodist? Memorial. When they open up, 10,000 slots were gone just like that. So if you were 10,001, can you imagine the frustration? And can you imagine just trying to get in that 10,000? So the good news is that there are a number of providers in the Houston region. The other thing that I want to point out, too, is that there are no geographical restrictions. So whether you live in Houston, whether you live in Harris County, whether you live in Fort Bend, there are no geographical descriptions to these hubs. But we do recognize that people are going to be frustrated because they're going to, they want to get in, and they're not, they're going to find that it's either not available or the lines are busy. But I would just simply tell you, just keep calling. As the days and weeks go by, it will become easier.
What are the challenges with drive-through vaccinations?
Oh, weather is one. That's one of the challenges is weather. The other thing too is bear in mind, you may be in your car when you get the vaccine, but you still got to go through that 15 to 30 minute monitoring period. So you're driving through, but once you get it, you can't drive away. So making sure that you have the parking space for people to take it and then to park, because they still have to be monitored. Whether you're in the car or whether you come in person, you still have to be monitored. Let me yield to Director Williams if I missed anything.
No, you did. Mayor, I was thinking as you were talking that you've actually listened to us. Yes, certainly weather is an issue. Space is probably one of the more critical issues. As I've said before, we have in fact modeled drive-through. The county's engaged in drive-through, and we expect that we will implement drive-through in the near future.
So we're going to do it, but we want to make it very clear that when it's done, you can't get it and drive away. Okay? When you get it, you have to, get it and then go to another designated location so that we can monitor you. So that will be added to our to the options that we offer. We'll be providing more fixed sites as well. The goal is based on supply to do some mobile sites, and then that there are still a number of people in the Houston area, for example, that are homebound. They can't get out, and so we also want to provide the ability to go and provide the vaccines to people in their homes.
How quickly do you envision other locations to open up?
I suspect next week. Director Williams and I, my good friend, are still talking about these major mega sites. If I have my wish, there will be 2 this coming Saturday. Minute Maid for sure. I know today that our team is looking at another site right about now as well. So depending as we have a conversation, and I understand what he does. Director Williams don't want me to offer another mega site, and as we know that we have sufficient amount for a mega site. And what I mean by that, you have to have enough vaccines for at least 3,000 or more. Otherwise, that adds to the frustration. So, Minute Maid, for example, we know we have enough, and we can do, close to 4,000 again at Minute Maid. We'll open up another mega site, and we'll see. And I'll make that. What's today? Today is Thursday.
Yes.
We're moving very quickly, so we shall see. But it's my hope to have another one for this Saturday. But
What
we'll
is
see.
the biggest challenge as far as not knowing the vaccine allotment? I mean, how much do you anticipate getting, or do you even know?
Well, that's the amount. I mean, they're sending more, but to have, let's say, 2 mega sites, you're talking about having enough supply for between 6,000 to 8,000 doses. Okay, and then bear in mind when we're getting the supply, it's not just for this week. Sometimes we're getting these supplies with the intent that it will carry forth to next week. Well, but there's a huge demand. And from the city of Houston's perspective, as we get them, we're not wanting to hold on to them for next week. My instruction to the health department is that we don't hold. We get out. We put them out. Well, we understand that we're working with our federal and state and local partners. I appreciate the support that we're getting. But on this end, recognizing the demand, recognizing people want these vaccines, whether the doses are intended for this week or next week, when we get them, I want them out. And that's my goal. So it does put added stress on the system because no one wants to hear you're out, but it doesn't do any good for these vaccines to be on the shelf or just waiting for next week. The virus is not waiting, and because the virus is not waiting, I don't want us to wait. So my plan is you send them, we get them, we dispense them.
Yeah, you mentioned the many centers is opening up, the many sites is opening up. What about people that do not have transportation? Can they walk up?
Well, that's why there are 4 clinics that we're working with,
Well,
if not more.
that is why we are strategically ensuring that there's some level of vaccine that are in communities. And you're in one of those facilities here near the north side where people that live in this area can access those sites. The mayor mentioned a couple of more sites where we ensured that there are vaccine and higher positivity zip codes. People will be able to access vaccine at those sites. But pretty much so now, it's really by appointment. You really need to access the various mechanisms to ensure that vaccine will be available for you when you get there.
And that's to maintain the order. Because if you open them up without pre-registration, for example, then they'll all be overcrowded, and that only adds to frustration. And then you have people congregating together, and then you have the spread. So that doesn't do anything. So we know it's frustrating to do the pre-registration, but it's the best way to do it in an orderly system. And then the goal is to just open up more sites. So we're here at La Nueva Casa de Amigos. There's a site in Sunnyside. There's one in Sharpstown. Okay. We're also providing at it some additional vaccines to a couple of other pharmacies, even as of today. So we're doing that. And then the more we get, we'll open up additional sites throughout the city, closer to where people live. So the degree to which we fill in our infrastructure is based on the quantity that we receive. The more we get, the more we can get out.
We have time for 2 more questions.
The phone number to get the test is the same number for the vaccine. How are folks supposed to sign up to get tested, like at facilities at the Aramco parking lot?
You're right. I mean, basically, those phones are triaged through our call centers. As more vaccine is available, that is going to change a little bit because we will offer opportunities for more online registration. Actually, we are projecting that in a few weeks we will have a totally new online registration system.
And Mayor Turner, do you have any kind of statement regarding the HPD officer that was in D.C.?
He should have been there. Look, you can go wherever you want to go, but when you're a governmental employee, you don't want to be a part of any insurgency group when we were supposed to be there to maintain law and order. That was not a wise decision, and there was accountability. So we maintain law and order. We don't participate in lawlessness. I have zero tolerance for that. So we need to get back on track, and civility is important. Respect for people's views and respect for our democracy. There are no excuses for that. So I don't have very much tolerance or patience at all on that end. So I think people need to count the cost. You know, but I'm very concerned where our country is right now. I'm very concerned. You know, I think we all have to participate to protect it. It's not a given, and we all have to be responsible, accountable, respectful, more civil towards one another. And I think and this is 2021. Leave that old baggage in 2020, and now let's work together to do it. And especially, you know, this is the most diverse city in the United States, but that's not enough. We work every day to be inclusive, and that's not just in terms of ideology or ethnicity, but on so many different levels. So that's the goal. But again, let me just say on this vaccine, the vaccine is important. I also want to remind people to get tested. Okay, yesterday, 2,200 plus cases in the city of Houston. That was a record for us in a single day. Now, we've had 2,200 or 2,000 plus 2 or 3 days, but we've never had over 2,200 in a single day of reporting. And so we're in the heat of this, in the middle of this storm. I suspect the next 2 weeks, 2 to 3 weeks, are going to be vital for the health of our community. And so I'm asking people to please work with us and stay away from the large gatherings. You know, stay out of these clubs, congregating, all of that. You know, just help us out. Just help us out.
Yeah, that's one thing I was going to ask, because you preach social distancing, but numerous nightclubs, restaurants are ignoring that, and even more, especially on the weekends, even more restaurants and bars are going past that and not not doing any type of social distancing. And you see that every weekend now.
I agree. I mean, there has to be respect of persons. Respect yourself. Respect your loved ones. You know, people are going back to their families. They're going back to with their friends. They're returning to their workplaces. And what we're finding is that oftentimes people who are coming down with COVID, they're not getting it from their jobs. They're getting it from when they leave their jobs and what they're doing after they leave. So you can only, look, we've been preaching this message for how many months? 10 months? We've been preaching it for 10 months. I don't know, for some it's gotten old. But the virus has not gotten old. So I'm going to be positive. I'm going to hope that people who are hearing me say it again, stay away from large gatherings. Even if you had lunch or breakfast or dinner, you can still keep your mask on until you finish eating.
Just an enforcement
Until
issue.
you finish. Until you eat.
I'm just saying, is this something that you can handle by enforcement or by the city, or how can you make it even more?
Well, we don't have the staffing to be looking at every single restaurant, every single club. People do have to assume personal responsibility. There's no substitute for people assuming personal responsibility and loving the people, your family members and friends. We can give you. It's like how do you say in my church? The good Lord feeds the birds, but He won't throw it in the nest. At some point, you got to get up and get it yourself. Well, I subscribe to the same view. If I tell you that hanging out together with no mask is not in your best interest or the best interest of your family members and friends, then you do it anyway, you have to assume the responsibility. But I can't be with you every 24/7. I can't do that. Okay? So, but having said all of that, I appreciate these doctors and staffers and people who are sacrificing for the rest of us. I appreciate the council member. I'm going to give you the final word, Councilman.
No, I mean, echoing what you said, Mayor, from Chief Ruth on down, the woman that was going to give me the shot, has given out 1,500 vaccines already. They are working around the clock, and our healthcare workers, our frontline workers, are American heroes. And it's up to each one of us, not just to protect ourselves and protect our family, but do our part to protect them and let them get the job done. So, again, masking up, just to add on to the end of what the mayor said with the vaccine, even after you get your vaccine, please continue to wear a mask and socially distance. It is not over after you get the vaccine. This is just one step in the process to get back to where we are going post-COVID, and we want to get there as quickly as possible. So again, thank you, Mayor, Director Williams, to the entire team, and to anybody out there that is considering having a baby. If you are pregnant or breastfeeding, please reach out to your healthcare provider. Ask the questions that you need to feel comfortable and safe about this vaccine. It's truly a blessing that we have this opportunity to be included in 1B and to protect ourselves and our future children. Thank you.
And if there's some other pregnant women who want to get a shot with the councilman,
Come on down.
come and join.
Please.
It would be, that would be
That's
good.
it. Yeah, that would be fantastic. And if anyone has questions or needs to reach out, you can reach out to the health department. You can also reach out to my office. I'm happy to share my story and my journey in coming to the place to decide to have the vaccine.
And then my director of health said, "Will you stop covered up with stuff and just throw it?" Let me go back to my office before I get fired. Okay, thank you.
That's fine.